treatment of high blood pressure. It is important to take steps to keep your blood pressure under control. The treatment goal is blood pressure below 140 over 90 and lower for people with other conditions such as diabetes and kidney diseases. Adopting healthy lifestyle habits is an effective first step in both preventing and controlling high blood pressure. If lifestyle changes alone are not effective in keeping your blood pressure controlled, it may be necessary to add blood pressure medications. In this section, you will learn about blood pressure lowering lifestyle habits and blood pressure medications. Healthy eating. Research has shown that following a healthy eating plan can both reduce the risk of developing high blood pressure and lower an already elevated blood pressure. For an overall eating plan, consider the DASH eating plan. DASH stands for Dietary Approaches to Stop Hypertension, a clinical study that tested the effects of nutrients in food on blood pressure. Study results indicated that elevated blood pressures were reduced by an eating plan that emphasizes vegetables and low fat dairy foods and is low in saturated fat, total fat, and cholesterol. The DASH eating plan includes whole grains, poultry, fish, and nuts and has reduced amounts of fats, red meat, sweets, and sugared beverages. A second clinical study looked at the effect of a reduced dietary sodium intake on blood pressure as people followed a typical Indian diet. Results showed that reducing dietary sodium lowered blood pressure. It shows the importance of lowering sodium intake, whatever your diet. Reduce salt and sodium in your diet. A key to healthy eating is choosing food lower in salt and sodium. Most Indians consume more salt than they need. The current recommendation is to consume less than 2.4 grams of sodium a day. That equals 6 grams of table salt a day. The 6 grams include all salt and sodium consumed, including that used in cooking and at the table. For someone with high blood pressure, the doctor may advise eating less salt and sodium, as recent research has shown that people consuming diets of 1500 milligrams of sodium had even better blood pressure lowering benefits. These lower sodium diets also can keep blood pressure from rising and help blood pressure medicines work better. Maintaining a healthy weight. Being overweight increases your risk of developing high blood pressure. In fact, blood pressure rises as body weight increases. Losing even 10 pounds can lower blood pressure, and it has the greatest effect for those who are overweight and already have hypertension. Being overweight or obese are also risk factors for heart disease. They increase your chance for developing high blood cholesterol and diabetes, two more major risk factors for heart disease. Physical activity. Being physically active is one of the most important steps you can take to prevent or control high blood pressure. It also helps reduce your risk of heart disease. It doesn't take a lot of effort to become physically active. Quitting smoking. Smoking injures blood vessel walls and spreads up the process of hardening of the arteries. This applies even to filtered cigarettes. So even though it does not cause high blood pressure, smoking is bad for anyone, especially those with high blood pressure. If you smoke, quit. If you doesn't smoke, don't start. Once you quit, Your risk of having a heart attack is reduced after the first year. So you have a lot to gain by quitting. Medications. Types of blood pressure medications. Here's a rundown on the main types of drugs and how they work. Often, two or more drugs work better than one. Diuretics. Diuretics are sometimes called water pills because they work in the kidney and flush excess water and sodium from the body. Beta blockers. Beta blockers reduce nerve impulses to the heart and the blood vessels. This makes the heartbeat slower and with less force. Blood pressure drops and the heart works less hard. ACE inhibitors. Angiotensin converting enzyme ACE inhibitors
Endogenous human
prevent the
BNP
formation
is
of a
cleared by
hormone called
receptor-mediated clearance.
angiotensin 2,
Endogenous human
which
BNP
normally
is
causes
cleared by
blood vessels to
receptor-mediated
narrow.
clearance.
The ACE
Endogenous
inhibitors
human
cause the
BNP
vessels
is
to relax
cleared by
and blood pressure goes
receptor-mediated
down.
clearance.
Angiotensin antagonists. Angiotensin antagonists shield blood vessels from angiotensin 2. As a result, the vessels become wider and blood pressure goes down. Calcium channel blockers. CCBs keeps calcium from entering the muscle cells of the heart and blood vessels. This causes the blood vessels to relax and pressure goes down. Alpha blockers. Alpha blockers reduce nerve impulses to blood vessels, which allows blood to pass more easily, causing the blood pressure to go down. Alpha beta blockers. Alpha beta blockers work the same way as alpha blockers but also slow the heartbeat as beta blockers do. As a result, less blood is pumped through the vessels and the blood pressure goes down. Nervous system inhibitors. Nervous system inhibitors relax blood vessels by controlling nerve impulses. This causes the blood vessels to become wider and the blood pressure to go down. Vasodilators. Vasodilators directly open blood vessels by relaxing the muscles in the vessel walls, causing the blood pressure to go down.